Okay, I think most folks from the waiting room have found their way in, so we can go ahead and get started. Make sure we have lots of time to get to our fantastic content for today's presentation. Welcome, everyone. Thank you all so much for joining us for today's session. This is part one of a webinar series on strategies for improving employee fulfillment and retention. I'm so happy to have you all here today with us. My name is Sydney Axelrod. I am the Associate Director of Workforce Development at ACU's STAR² Center. This is the rest of the lovely STAR Center team. Just want to flag for you all, you have all of our email addresses here. So if there's anything you'd like to follow up with us about after today's session, please don't hesitate to reach out to us. The STAR Center is a part of ACU, or Association of Clinicians for the Underserved. We are a national nonprofit organization. We were started nearly 30 years ago now by alumni of the National Health Service Corps. And that really remains at the core of who we are and what we do at ACU. There's a lot of really wonderful program going on, and it's really all serving to support the workforce at community health centers and adjacent organizations providing care to the underserved. We are here today specifically on behalf of the STAR² Center, that stands for Solutions, Training, and Assistance for Recruitment and Retention. We are funded through a national cooperative agreement. We were first awarded in 2014. So this is actually our 12th project year. And we are funded by BIPIC, the Bureau of Primary Healthcare, and HRSA, the Health Resources and Services Administration. And our national cooperative agreement includes 21 other wonderful organizations, and altogether, the 22 of us are considered National Technical Assistance Program or partners. And the beauty of this cooperative agreement and this NTAP program is that all of our resources, our training, and our technical assistance are available to all of you free of charge. So while the STAR Center is a part of ACU, we do have our very own website, chcworkforce.org. And we'd encourage you all after today's session, when you have a moment, to have a poke around there and see if there's any other resources, recordings, fact sheets, you name it, we've got it, and happy to support you in your work. You can also always reach out to us if you're not sure who directly to contact. You can send a note to the info@CHC Workforce account. That goes right to my inbox, and I'm happy to send that out accordingly. So we're really excited to have you all here for today's session. This webinar series is being produced in partnership with our wonderful colleagues over at NACC, the National Association of Community Health Centers. They are another one of those wonderful 22 organizations that is also, it has an NTAP program. And so the STAR Center is sort of facilitating for today's session, and NACC will be facilitating next week's session, where we'll hear from another wonderful health center. So just a few quick housekeeping things, and I promise we'll move along and get into the good stuff. But just for all of your awareness, this presentation today is being recorded. The recording will be sent to everybody who emailed, everybody who registered. It will be emailed to you. We just ask that you please be present. It's wonderful to have everyone engaged. You're welcome to use the chat box at any point to share your comments, your questions, your thoughts. We'll keep an eye on that and make sure we get to those. If you're having any kind of technical difficulties, please just send a message or an email to my lovely colleague, Mariah Blake. She is more than happy to help you with any of your kind of tech needs behind the scenes. And then lastly, just a heads up, we'll have a very brief evaluation. It will pop right up on your screen at the end of today's session. We ask that you please just it'll take just a minute to fill that out, but it's really helpful information for us to make sure that we are delivering programming that is useful and relevant to all of you. So just a little heads up about that. Okay, I think that's enough of the boring stuff, and I think we're ready to dive right in. We are so delighted to have our guest speaker here for today's presentation. You know, when the STAR Center team sat down with the NACC team to think about delivering a webinar series around well-being and retention and fulfillment for staff, we thought who better to share about these concepts than a health center that's already doing really wonderful work around this. right? We are sort of subject matter experts in the field of recruitment and retention and workforce well-being and all of these lovely things. But you all are the ones who are on the ground doing this work every single day. And so we thought it would be really amazing to hear from one of your peers and colleagues, because a lot of times we look at these organizational challenges and it seems like where it's a real uphill battle, and like it's impossible to implement all of these things that we know in theory would be great for our people and our community and our patients that we're serving at the end of the day. And we're here to tell you that it is possible. And so really, really thrilled to have our lovely presenter here today, Jaquetta Gatling. She is here. She is the Workforce Development Coordinator at Roanoke Chowan Community Health Center. And when I first connected with Jaquetta, I was just blown away by all of the fantastic work that she is doing within her organization to really support the well-being of her staff through this lens of growth and opportunity and approaching it in a really strategic way. So without further ado, I'm going to pass the mic over to Jaquetta, and I'm really excited for you all to hear about the incredible work that they have been doing over at RCCHC. And again, as we go along, please feel free to put your questions in the chat. And up over to you, Jaquetta.
Awesome. Thank you, Sydney. So good afternoon, everyone. It's so hard to go behind that introduction, but I am Jaquetta Gatlin, and I serve as the Workforce Development Coordinator here at Roanoke Chowan Community Health Center. So I oversee workforce initiatives, including clinical rotations, student observations, job shadowing, internship, apprenticeship, preceptorship programs, and I'm also the internal trainer slash facilitator. So today, I'm going to walk you through how we've redefined workforce well-being, not as a wellness initiative, but as a strategy. Workforce well-being is not a benefit, it is a system. Next slide, please. So who are we? We are a rural health center located in northeastern North Carolina. We serve communities with complex health care and workforce needs. We operate across 6 clinical sites, 4 primary care sites, 1 comprehensive location, and most recently, a dental and primary care clinic. We provide services including primary care management, case management, diabetes management. We have a rural residency program. The list goes on. In rural healthcare, we are not just managing patient care, we are navigating shortages with limited resources and high demand. So rural healthcare means fewer resources, but higher workforce pressure. Next slide, please. When we hear workforce well-being, we often think about things like self-care initiatives, appreciation days, work-life balance, and those things are important. They matter, but they don't address the root issue. Wellness activities don't fix broken systems. Next slide, please. So let's just take a moment to understand what burnout really is. People don't leave because they're tired. People often leave because they feel stuck. When we look deeper, burnout isn't or wasn't just stress for us. It showed up when people experience lack of growth, no room, lack of direction, not knowing where to go next, lack of opportunity, not being able to move down the talent pipeline, and then lack of investment. When people don't see a future, they will quickly disconnect from the present. Next slide, please. And this is just a visual of understanding burnout. All right, next slide, Sydney. We find that burnout decreases when systems are clear and intentional. Career pathways with stackable credentials so staff can see their next step. Structured classroom training, in-house learning, and upskilling. And I'll go in more detail. Ongoing support through their journey, feeling like they're supported. Clear expectations for success, because clarity reduces stress and structure creates stability. All right, Sydney, next slide. So what is the workforce reality? Like many organizations, we were facing really real challenges. We were dealing with staff shortages. We were dealing with burnout across teams. We were dealing with competition with larger healthcare systems and limited career pathways for our staff. So I want to pause for a minute because this wasn't just about numbers on a report. This was real world experiences and challenges. It looked like teams were being short staffed with staff picking up extra responsibilities, leaders trying to fill in the gaps, employees trying to figure out what their future will look like here. And I'm sure that some of you have experienced this or are experiencing it now. And I can't see everybody nodding or agreeing, but I just strongly feel so. And what we realized was we were trying to recruit our way out of a development problem. We were focused on filling positions instead of building people. We were looking externally for talent while overlooking the potential we already had internally. And no matter how much we recruited, it wasn't going to fix what was really missing. So instead of continuing the cycle, we made a decision to shift our approach completely. Hold on to your seats. Go to the next slide for me, Sydney. So we had to take a step back and think about what workforce well-being really meant for us. Because workforce well-being is more than self-care, especially in rural healthcare. In our setting, we don't always have the luxury of excess staff, extra resources, or large talent pools. So when we talk about well-being, we can't just focus on helping people cope. We have to focus on helping people grow. Well-being must include an opportunity. It must include growth. And it must include a future, because when people can see where they're going, you like to have direction. When they know there is a next step, when they know that someone is investing and someone truly cares, that's when engagement is increased. That is when burnout decreases, and that's when people stay. People don't just want support, they want to be directed. And in many cases, the people we're trying to recruit were already in our organization. They just needed a pathway. Next slide, please. So workforce well-being doesn't happen by chance. It happens by design. So workforce well-being equals access to growth. Retention does not drive retention. Growth drives engagement. Engagement drives retention. Next slide for me, Sydney. So once we've reframed our thinking, we had to clearly define what workforce well-being actually is for our organization. And for us, workforce well-being is a system-level strategy. It is not a single program. It is not just an initiative. It's not something we do once a year. It's how the organization functions to support its people. And we built that across 4 areas. We built it through growth, because growth means creating career pathways and opportunity for advancement, not just telling staff they can grow, but showing them. When you show people, they believe it. What's the next role? What skills do you need? How do you get there? When people can see growth, they stay engaged. Structure is about clarity, clear onboarding, clear expectations, clear workflows. That's all healthcare. So people are not guessing their way through their roles. They are sure of their roles, because confusion only creates stress, but structure creates stability, which is what we want. Yes, I'll provide a copy of the slides, and I have another benefit too. I'll tell at the end that I have to share as well. Opportunities where access comes in: internships, apprenticeships, educational support. This is how we open doors that may not be accessible before. One of the things about educational support, and I'll just give you a snippet, we do educational reimbursement here. And while our students are earning while they learn, we also provide them with educational time. So staff is not missing out on their wage or their salary. But hold your seats. I'll tell a little bit more about that strategic approach. Opportunity is what turns potential into progress. And then support is what sustains everything else. People need to feel supported. Mentorship It's leadership visibility and recognition is all part of support. Making sure people don't feel like they're navigating in something alone. Because growth without support leads to burnout, that cycle again, which does not lead to success. When all of these things come together, and that's growth and structure, opportunity, and support, that's when workforce well-being really becomes real. People will thrive when they feel capable, supported, and seen. And that doesn't happen by accident, it happens by design. So, how do we actually build this into our organization? Next slide, please. So, after identifying our challenges and redefining what workforce well-being truly means, we realized something had to change. For a long time, like many organizations, we focused heavily on hiring externally, posting positions, recruiting candidates, trying to fill immediate gaps. But that approach wasn't solving the root cause. So we made a shift from hiring externally to developing internally. We stopped asking, where are we going to find people? And then we started asking, how do we grow the people that we already have? Because when you invest in your internal workforce, guess what you do? You create stability, you build trust, you increase engagement, and you reduce that burnout. You have to remember, you do not find your workforce, you build your own. And in many areas, your future workforce is already sitting in your organization. They just need a pathway. And that's exactly what leads us to build a structured workforce pipeline. Next slide, please. I'm a color person, so I made this strategic model a little colorful. So let's start with this slide represents our full workforce ecosystem. And this is where everything comes together. This is how we move from programs to a system that supports workforce well-being. It starts with early exposure because this is where everything begins. This is the first point of connection into healthcare. For us, early exposure includes things like job shadowing, attending career fairs, partner engagement, student observations, but we didn't want this to be an occasional exposure. We wanted it to be structural and intentional, has to be intentional. So we built stronger partnerships. And one in particular that we have now and has opened the door for others is with our early college high school. Typically, the early college high school wants their juniors to do 10 years of job shadowing experience. And then their senior year, they used to want them to do 100 hours. Now, we do have to ensure that we take in consideration our staff, right? And making sure that we realize that they do sometimes need a work-life balance when it comes to preceptorship, and I'll talk more about an observation job shadowing. So I met with the school and I said, listen, we're in full support of allowing the students to come. We love them. However, 100 hours may be a little extreme for our staff to have 50 hours in the fall and 50 hours in the spring. So we came to a mutual agreement. Guess what? They can do 50 hours starting next year, and those 50 hours could be done either in the fall or in the spring, which gave more individuals, because healthcare for occupations for students is on the rise. And so that gave them the opportunity to have more students come, but do more structure. Those students actually go into a full onboarding. They get to visit and tour the facility. They also wear a badge because we want them to be identified early on who they are. It gives them that exposure. And what that does, it moves students from just observing to actually engaging. So when they come to shadow, they may walk around for a little bit and be with a provider, they may be with a nurse, but we call it like a day in the life. They're not just watching anymore when they move into internship. They're understanding roles, they're able to ask more questions, and they begin to see themselves in those positions, talking about reality. And this is where awareness turns into interest, and interest turns into intention, one of my favorite words. And from a workforce well-being perspective, this is very critical. because we're not waiting until someone is already burned out or stuck. We're building clarity and confidence very early on. Go to job fairs, bring it to within your community to share what you all are doing. We're helping individuals make informed decisions about their career pathway, which leads to better alignment and stronger engagement and long-term retention. This is where we spark interest, but more importantly, this is where we begin building the future workforce. And once that interest is established, we already are ready with the next step. And that's what structured learning comes in. And you see here in the yellow, that is where early interest has been established. We have to be ready with the next step, and that's the structured learning piece. This is where learning, one of my favorite words, becomes intentional, but guided. It's now not just about exposure because you've exposed them. It's now about building knowledge and tapping in to develop those skills even more. It includes classroom instruction, and I'll go in detail about it, certification programs and internal training opportunities. But for us, it also means very intentional about how we prepare individuals before they ever step fully into a new role. This is where potential begins to take shape. And from there, we move into applying that learning in real environments. Our work-based learning is our purple. This is where work-based learning comes in because it includes internships, it includes clinical rotations, clinical skills, hands-on experience within our organization. Our internship program is designed to go beyond observation. Interns are not just present. They are learning about workflows, understanding expectations, and becoming familiar with real healthcare environments. And this is where we begin to align this experience with onboarding, because by that time, many of our interns transition into roles, or they already understand our system, our culture, and our expectations. We're not starting from zero, we're building from familiarity. So that reduces our training time and it increases people's confidence, which is what we want to do, and creates a smoother transition into employment or into other opportunities. But that pathway has now been developed. And for many, this is where the pathway continues into something even more structured. So for individuals who want to continue growing, it moves into that apprenticeship model. After exposure, job shadowing, early experience, it moves into structured learning where skills and knowledge begin to develop, hands-on experience, and real-world application. And then it becomes a formalized pathway through apprenticeship. And that is like my baby. All of it runs together, but apprenticeship is where everything becomes structured, more intentional, and more supported. It's where individuals are no longer just exploring, but they're committed to a pathway that they can move along the pipeline. In our apprenticeship model, and I'll go deeper into our apprenticeship, but we have 10 occupations, and I'll highlight more about that. We are a permanent status apprenticeship program with the state of North Carolina. If you're a YouTuber or like to watch YouTube, you can search us on YouTube. For last year, 2025, we were the Outstanding Apprenticeship Program Award recipients. They say RAP for short. We don't rap, but it's up there. It's RAP for short. And you'll be able to see a little bit snippet of our story and one of our partnerships and one of our apprentices. And I'll share more about her in just a moment. So it's earning while you learn. It gains on-hand experience in real clinical settings. It helps them to participate in a structured classroom instruction, and they're able to progress through clearly defined milestones. There's that direction. It's not separate. It's a continuous pathway. And from a workforce well-being perspective, it matters because people are not left wondering what's next. They can see it, they can plan for it, and they can grow into it. And when people can see their future, they are more likely to stay committed to the present. And that's why I love so much about apprenticeship, and I'll go more into that. Our apprenticeship model has become one of the most impactful parts of our workforce strategy. We've developed multiple pathways to develop workforce needs across the organization. We currently have 10, as I mentioned, different apprenticeship pathways. And I won't get caught up with saying them all because I know I'm probably going to miss one, but I'll just name a few. We have one or two that's a non-healthcare related. So we have IT, We have what we call a patient account representative, or PAR for short, that's front desk. We also have LPN, RN, RMA is one of our most popular ones. And then we have our medical laboratory technician, our medical coding and billing, and I know I'm missing a few, but these pathways are designed to support both clinical and non-clinical roles, meeting people where they are and helping them grow to what they want to be. Our MA is our, as I mentioned, was our most popular. This pathway has been very impactful because it helped to address a critical workforce need. We saw the need for MAs, but it also created opportunities for our staff. Are the pathways through partnerships with the schools? Yes. And I'm about to go into that right now. I'm going to talk about MA particularly. I'm so glad you asked me that. Yes. And we call the schools our providers, our training providers, as far as it's related to the apprenticeship program. So what we started with RMAs, we saw there was a need for RMAs. A lot of times we say an MA is a step above a CNA and one step below an LPN, but it's part of the pipeline. It's part of that stackable credential. And so with medical assistant, we saw that we had a need for MAs, but we didn't have a school within our training area that could actually do that classroom instruction in person, not yet. So we started by pitching with NEMA or partnering with NEMA, and we still have them as one of our training providers. Yes, we have a lot of partnerships with scholarships and funding too. So I would love to hear more about it as well. So we searched and tried to find a school that could actually give some individuals in-person instruction because everybody doesn't learn well online, and that's okay. That's okay. So we did keep our partnership with NEMA because partnerships are great, but we saw the need to have some type of in-person structure for our RMAs. So we searched and thought about. Sydney, next slide, please. I'm sorry, it'll go into this. I'm sorry. I'm getting excited about this. So we thought about what we could do to get our RMAs classroom instruction and stay in compliance with our apprenticeship program. So we developed and started meeting with a local community college, maybe about a few minutes from us, and said, we are looking for a medical assistant program to send our staff. And they said, okay, we'll search the curriculum, see can we find it in the course library, and we'll offer the course. Well, then there was another barrier. We can't find anyone to teach it. So RCCHC said, we'll give you an instructor, a qualified, trained nurse manager that's already in leadership that can train our staff and ensure that they pass the certification and can work in MA capacities. So in 21, we partnered with RCCC, which is Roanoke Chowan Community College, and we started our first cohort of medical assistants through a local community college. They receive, the training is 9 months. The first 4.5 months, they receive classroom instruction, fully classroom instruction. And then the last 4.5 months is clinical skills. So it's two parts. Part one, classroom instruction. Part two is the clinical skills. Interesting enough, they were doing it on the campus of the college. And then when they went into the clinical skills part, guess what? They did their clinical skills here. So that was a twofold. And what ended up happening was after those MAs were successful, so they moved down our talent pipeline and through the apprenticeship program. So our RMA is a 2-year program if you have no prior learning. So you get about 1 year of your classroom instruction through apprenticeship, and then that 1 year of on-the-job training. Once you're done with those 4,000 hours, then you're exited as a journey worker through the apprenticeship program, and they send you a certificate and a patch. We just celebrate that. We post them in our newsletter. We share it internally across our organization. But not only did us starting that pathway open up more doors of opportunity, our RMA program started to soar. we actually give them a graduation. So they actually are able to invite their family, and you'll see photos of that. They're able to actually invite their family. They're able to, we feed them. We give them a speaker because a community college doesn't typically do a continuing education graduation or recognition program all of the time. But we wanted them to know we celebrate them, we encourage them, we support them. And so from that 2021 beginning of that partnership, that cohort has now grown tremendously. And I'll share a little bit about it and I'll move on because I could share so much about it. Have you partnered? Yes, we are partnered with National Health Career Association, which is NHA. We've partnered with NEMA, and it's like once you partner with one, all of them want to reach out to you. And so it's good to have options because you want to make sure you have things that will work for your staff. I'll talk to you about that. So we wanted to ensure that they had coverage. So when they went into that cohort, they only met 1 day a week. Our organization closes at 1 on Fridays. So they typically would go to class on Fridays. While in class, we still paid their salary, which was called, we gave them educational time. We ensured that there was coverage while they were actually in class. What that cohort did was it opened the door for additional 4 cohorts since then. So to date, not only has the RMA program expanded, but it's now opened up to our entire community. So now, not just RCCHC staff, because you can only have 10 students per class, but now it's offered to our local hospital. If it's just someone that's interested in taking RMA and potentially, having an occupation at RMA, it's open to them. That staff member is still teaching that course. However, they're able to enroll other than just our staff. And the interesting part, it is so popular now. We have 2 cohorts and 2 instructors. That's how much it has expanded. So one class meets on Fridays and one class meets on Tuesdays and Thursdays. And how it rotates is one may be in classroom instruction and one is then in clinical skills. And those individuals, non-RCCHC staff, still do their clinicals here. So we let them train with one of our staff members that's a seasoned RMA for those requirement of those 160 clinical hours. So they're able to get into the EHR, they're able to help see patients, they're able to do all the scopes of practice with structured learning with our staff. The interesting part about that, we call it preceptorship. So our seasoned MAs are able to precept newer MAs or students, and they receive an honorarium or an incentive for supporting those MAs through school. All right, next slide, please, Sydney. So we were talking about building partnerships early. And I'll go more detailed into that about building partnerships early. One of the biggest shifts we made was when we started thinking about workforce development and what we needed to do until positions are open at a student level. So we began building relationships early through high school, through early college, through community colleges, and partnerships. One of the biggest things with us with high school was that job shadowing. That was part of our exposure. But when I came on board back here in 21, I was given a task of developing a paid internship program. So we did have internships, we did have job shadowing, we did have observation, but we did not have a full-fledged paid internship program. And I had a short amount of time to build it, like maybe 60 days of time. However, what happened, we received this grant through what's called Camber Foundation. And so in that grant that we received, we had a partnership with Early College High School. So this was the development of extended partnerships. It's going to make sense to you in a minute. We were able to, in that grant, we wrote in, it was to have early college students come for 1 semester and then 2 semesters Chowan University students, which is a university that's about 20 minutes from our main location. And so we decided to have the early college high school students to come in the summer. So they came for 6 weeks. They were actually put into our EHR. They were actually at the front desk. They would receive a job description. They received onboarding. If they needed to be in EHR, they were in EHR. What this did for the students was give them exposure. What it did for our staff was it allowed some of them that had never been in a leadership role or capacity to look through a leadership lens. So it motivated them as well. We got very creative in thinking outside of the box with this grant. We had 1 year to expend the money. So once we were successful with the early college students, I couldn't take a breath because I had to develop more initiatives now and more strategies to prepare for the Chowan University students. So we had about 10 early college students, and then the first semester with Chowan was that fall. We had about 7, and I really got strategic because one in particular that I sometimes chuckle about is one young lady. There are a lot of international students at Chowan University. And so one of the things that I love about it was one young lady that was there. She came and she wanted to go and get a career in organizational management. And so I was like, where can I put her to give her an impact? So I put her in the CEO's office as the CEO's executive assistant. And she was able to learn about board and policy. It also gave our executive assistant, the CEO's executive assistant, who had never had any leadership background, a lens into being a leader. And so it's just about those things and investing in your people and showing them that you believe in them. Next slide, please. These are some of our partnerships. And I know someone's asking me about a partner, so National Health Careers Association, NEMA. We have a partnership with Halifax, and I'll talk a little bit more about that. Martin Community College, Pitt Community College. So these are included in our apprenticeship standards. Our staff can go to any of these colleges for apprenticeship for structured classroom learning. Another thing, give me 1 second. Okay. Can you go back one slide for me, Sydney? Okay. And so partnerships are vital because that's what helps to continue to keep your staff trained. That's what helps to keep moving them down the pipeline. That's what helps to develop those pathways. All right, next slide for me, Sydney. I talked to you about our apprenticeship overview. It's the paid on the job training. So earning while they learn, that classroom instruction. This little graph you see here, because I know a lot of people love data. So this graph that you see here is our apprenticeship program performance measures for 25. We had a retention rate of 85 to 90% of our staff that have been through the apprenticeship program. It also helps that they get a progressive wage. So while they're moving through the apprenticeship program, they get a wage in intervals. And then they also get that mentorship and that milestone based on the evaluations. All right, next slide, please. Our preceptorship program that I mentioned earlier, because it helps to show that people feel supported. We also do what's called a preceptorship training. So through AHEC, and I know you saw that was one of our partners, we do give them that preceptorship, clinical preceptorship training online. But me as being a curriculum builder, I also do a training with them, just letting them see that this is a leadership opportunity. You're going to be there as their role model and as their mentor. You're going to be able to support them. What you're showing them is going to impact them and their skills and what they do. So it's also incentives and stipends. So that helps to also boost their morale and help them to feel supported in that leadership role. Strong preceptors do support directly strengthens our retention and workforce stability because that's what you want. And that helps to increase and improve your patient care. Next slide, please. I want you to remember that this is more than just a program. It's about its structure. It's about a structure. And that's where workforce well-being really becomes real. When it's not something we talk about, but something people really actually experience. well-being becomes embedded and not just an add-on. And that's how you build your infrastructure like this. That's how you see the impact, not just in systems, but in your people. Okay, at the end of the day, that's what it comes down to, internal growth over external hiring. We made a very intentional decision, there's my word again, to prioritize developing the people we already have instead of constantly looking outside to fill our roles. Not because external hiring isn't important, because it is, but because we recognize the value of investing in individuals who already understand our organization, our patients, and our expectations. So we chose to build from within. And what we've seen is a clear pattern, investment leading to retention and retention leading to stability. And when you invest in your people, they feel valued. When they feel valued, they are more likely to stay. All right. Next slide, please. This is just an overview of your staff, your students, your apprentice, your leaders, internal growth over external hiring, and then that investment, that retention, those are words we love. Stability, which equals your workforce development and your workforce strategy. And then next slide, I want to give you a couple of real world experiences or impact stories. This is Akiba. She was hired as a patient navigator. We have many, but this is just a few of them. She was hired as a patient navigator for pharmacy. She decided that she wanted to go to school and be a medical assistant. So she enrolled in NEMA. She explained to me that, being online was more beneficial for her. And at the end of the day, we want to do what's best for our staff so that they will feel supported. She finished NEMA. In the beginning, when Akiba shared that she wanted to go to NEMA, it was actually 3 people. The other 2 decided that that curriculum was just a little too much and they rather been in person. So they wanted to wait for the next in-person class. Well, she said to me, I'm going to do it. This is going to work for me. So she was our only staff member in that cohort for that year, and that's okay. We still fully supported her. And this picture that you see is some of our staff supporting her, and I'll share more about that. Akiba became an RMA or CMA, and then she decided to take a role in PEDS. So she actually this month is coming up on her 1 year of RMA. Our preceptors, we have a criteria or requirement that you have to have been in an MA role for 1 year prior to being a preceptor. So close to her 1 year before going into an agreement with preceptorship, I decided to give her a student to let observe with her for 10 hours because that's now getting her into the practice before she shifts into that preceptorship role. So she'll become a preceptor at the end of this month. And then as you see, that's at the bottom, that's my visual. Entry, development, advancement, leadership. Okay, next slide, Sydney. This is Latoya. Latoya was a first of many with a lot of things here. So she was one of our first, she was in the first cohort of MAs. She was in the first cohort of LPNs. And she's now going to be in one of the first cohorts of RNs. And I'll share a little bit about that, what I mean. So Latoya started here as a CNA. She decided that she wanted to go and be an RMA. So she enrolled in an apprenticeship program. She got that structured classroom training or instruction. And then she was able to do the clinical skills, which she was already a CNA. So she knew some of those skills. And then she was able to earn while she learned through wage progression. And then she advanced to a registered medical assistant journey worker, where she worked as a medical assistant for a year, and then she became a registered medical assistant preceptor. And then she came to us and said, I want to go to school for LPN. So we searched and found funding to fully support her in school for LPN. This local community college did not have a current LPN program. So I believe they're going to start in 2027. We decided to reach out and partner with Halifax, which is about maybe an hour. So another training provider added where they had a MA to LPN pathway. So for 9 months, she would go to school. And then guess what? She earned her LPN. So then she was exited from apprenticeship as an LPN and a preceptor. Now in this role, she's decided she now wants to become a registered nurse. And so she'll be re-enrolled back into apprenticeship and she will become a registered nurse journey worker. Not just that, what you see is not only is she on our video for our registered apprenticeship program award, but she also goes and speaks at apprenticeship summits and shares her story and how impactful it's been for her being here with RCCHC and how we have helped to move her down the pipeline and how it's motivated her and that she plans to retire from here. Next slide, please. This is just a snippet of some of the things that we do to celebrate our staff. I know it's a little bit distorted, but just wanted to share with you what we do. There is a National Apprenticeship Week. So every year, I think last year they just did a National Apprenticeship Day. But when they did National Apprenticeship Week, I believe in 24, we actually shared apprentices all through the day on all of our social media handles or platforms to let them know that we supported them. Oh, their families were sharing it, people within the organizations were sharing it, and we were just giving our highlights on some of the things that our staff do and how they're celebrated. We also had an internship day. We gave our interns a luncheon, and we also spotlighted them on our social media handles as well. Next slide, please. So at the end of the day, that's what it comes down to, internal growth over external hiring. And we wanted to be sure we were intentional with our decisions to prioritize developing the people we already have instead of constantly looking outside of it. We did choose to build within. And as we continue to grow these efforts, we realized something important. We moved from an individual program to a full workforce system. And it was no longer about separate initiatives at all, like internships here or apprenticeships there. Everything became connected. Each part of our pipeline began to support the next, and early exposure led to structured learning, and then structured learning led to hands-on experience. And then that experience led to apprenticeships, and that led into long-term career pathways where nothing is standing alone anymore. Everything is working together. And that's where sustainability comes in, because we're no longer starting from scratch every time we have to. We have a system that is continuously developing talent and a pipeline that is always moving forward. And just as important is alignment across departments, alignment with leadership, alignment with our partners, and that way everyone understands the pathway and what their role is within it, which ensures that the work is consistent, and my word again, intentional across the organization. And when we combine sustainability and alignment, we create a system that not only works, but continues to grow and improve over time. And from a workforce development well-being perspective, this creates stability, pathways, constant support, long-term opportunity. And this is how workforce development becomes long-term and not temporary. And through this process, we've learned some very important steps. Next slide for me, Sydney. As we implemented this work, we learned some important lessons along the way because none of it happened overnight, and some things are still evolving. So these lessons helped us to move from ideas to implementation. We had a vision, we had the concept, but we needed the structure behind it to make it sustainable. Because without structure, nothing won't work, and then nothing will work. And then structure is what turns ideas into action and plans into process and opportunities into outcomes. And what we learned is structure must be established early on. You have to have a system to track because that's essential for you to stay sustainable. You want to be consistent with communication because that's what helps keeps everything in line. And then your leadership support is very crucial and critical to long-term success. Without all of those pieces in place, things become inconsistent and processes break down and the impact doesn't last. And from a workforce well-being perspective, structure creates clarity. People know what to expect, they understand your pathway, and they feel more confident navigating their role. So structure will reduce your uncertainty, and uncertainty is one of the biggest drivers of stress and burnout. So lessons didn't just improve our programs, they strengthen our entire approach to developing and supporting our workforce. So if you're thinking about how to start, It really begins with building that structure intentionally. Next slide, please. I know a lot of you may say, it sounds great, but where do we start? And I'll tell you truthfully, you don't need it all. You just need to start. You don't need a full system in place. You don't need multiple programs at one time. You don't have to figure it out all overnight. You start small, choose one area of need, one role, one opportunity, and be intentional. Think about what that pathway could look like, what support is needed, and how you can structure it from the very beginning. And focus on one pathway at a time, whether that's internships with one intern, whether that's apprenticeships or internal development. And then you build it, you refine it, and then you grow it. Because once you build one successful pathway, you can replicate it, you can expand it, you can strengthen it, because that's how we started. We did not build everything at one time. We started with one pathway and we built from there. Please remember that progress is built step by step, not all at once, not all at one time. And even small steps in workforce development can have a big impact on workforce well-being because every pathway you create is an opportunity for someone to grow. All right, next slide for me, Sydney. This is just a visual of the talent pipeline of Grow Your Own. That's that stage one of exposure, that entry of hands-on, that training with skills and certification, your employment, which is your full-time roles, and then that advancement. Okay, next slide. This is our workforce well-being framework. This is just a visual of some of the things we do. Since me being here at RCCHC, I have developed a workforce work group, so they help with a lot of the initiatives as well. So I don't do this work alone. We do have a team that helps to support me as well. Next slide, please. So I want to remind you that workforce development is how we build a workforce that lasts. Remember, when you invest in growth, your staff will stay. That's your retention. Your leaders emerge. That's advancement. And your communities thrive. That's prosperity. Next slide, please. I want to thank you all for your time. I hope that this was very helpful. My information is there. Please feel free to reach out to me at any time for any questions. I also wasn't able to share everything, and so I did create a little manual that I'll share with Sydney of some of our highlights, our success stories. This framework is in there. A lot of little different things. It'll be an online booklet link. So you all feel free to look at it, to reach out to me, to ask questions, and I'll be willing to help in any way. Thank you.
Wow. Thank you so much, Jaquetta. I don't know how I follow you. I'm really just blown away by all of the amazing work that you're doing and cannot thank you enough for taking time. I don't know how you find time to eat lunch, let alone come share your expertise with us with all the amazing things you have going on. And the praise is coming in the chat. On your screens, folks, in just a sec, you will have pop up an evaluation. Please just take a couple seconds to fill that out for us and show your love for Jaquetta and for the Star Center team. Thank you so much for joining us today. If you want to make sure that you don't miss out on other great trainings like this one, please make sure you're signed up for the Star Center's newsletter. You can hop on right here and stay up to date with all of our goings on. I'll leave that up there for a second. And of course, you can always follow up with our team as well if you have any additional thoughts. But thank you all so very much for joining us today. Thank you to our partners at NACC and to, of course, the incomparable Jaquetta for sharing all of the amazing work going on at Roanoke Chowan. Thank you, everyone.
Thank you so much, Sydney.